Welcome to County Edition, your new go-to educational source for complex issues that face Sacramento County. I'm your host, Jose Vega, and today we're diving into a topic most parents, youth, and adults try to avoid. So stay tuned as we explore the importance of getting tested for sexually transmitted infections, to learn about their treatment, and what resources are available in the county to better understand your sexual health. To discuss this important topic with us, we have Dr. Jason Gritti, who's amazing. Your bio was almost 2 pages. You've done amazing work, and thank you. It's an honor to have you here. So talk a little bit about us. Talk a little bit to us about all the great work you've done, all your credentials. Share with us that.
Thank you very much for having me. I'm an internal medicine doctor. I've been practicing out here in California for about 11 years with Kaiser Permanente in outpatient internal medicine. Triple board certified, so I'm also certified in preventative care with lifestyle medicine and obesity medicine. I started doing the equity, inclusion, and diversity work about a year after I got here when I realized that there was a very vulnerable patient population that wasn't being served. And that is how you and I met at the LGBT Center, where I started working as the volunteer medical director, doing some of this important work.
Yeah, and you and I met at the center because we were focusing on sexual health. And for our viewers, what is sexual health?
So sexual health is a complex conversation.
Yeah.
Part of that would be STD screening, including gonorrhea, chlamydia, syphilis, HIV testing. The reason that's such an important aspect is most of the time when someone actually does contract STI, they actually asymptomatic and they don't know. And so frequent testing is actually very important. As a primary care doctor, our role is really important in asking these questions and making sure people feel safe enough to be able to be honest about their sexual history to ensure they can actually get adequate testing.
I love how you just specify that as a physician's role is to ask these questions. But for our viewers, sometimes it may be a taboo. It may be they're not uncomfortable talking about that topic. And I say this because we went out into the community and wanted to ask people, what do they know about sexual health and how important is it to them? That it was like a dart in the dark. Some folks said, oh, no, I'm not interested in talking about that, or I can't talk about that. Others were like, no, here, put me on camera, let me talk about it, let me share the importance of it. So let's share some of our viewers on what they had to say.
I think sexual health is very important. I believe you should go and see your doctor, gynecologist, or your primary care physician at least, once a year.
I think it's extremely important. I think depending on how sexual active you are, you need to probably go and get checked out every 3 months. I mean, it just depends if you're having one partner or if you're having several.
Every 6 months, but before any new partner, I would definitely get checked out just for your safety and their safety as well.
Every 6 months or every time you have a partner or if you see anything, you notice anything within your body, any little bump, any little something, just go get checked.
Yeah, I think sexual health is very important in somebody's well-being. It's a huge part of our lives, and it's something that we need to destigmatize and make sure that we talk about and discuss with the people in our lives, the people that we love, and the people that we are sexually active with.
It's important because what it does is it makes you very cognizant of yourself and your responsibilities for the things that you do and the things you do with others.
I think it just starts with the physician. I think just setting a safe space for them, knowing that there is no judgment.
I would personally probably start with my physician just because it's an easier way to go. You're supposed to be there to talk about your health, so it can kind of be a good run-through practice.
And I think sexual health is very important because everybody's, grows up differently, and I think it's important to be aware of your sexual health.
I'm from India, so it's a totally different culture. We don't talk about sex. It's a bad word, even if you are going to marry. So the other thing is I love the way we are talking here. And the thing I would say that first the parents are the first person who should start talking to their kids about what's going to be happen and how to manage. And then talking to your partner when you have a partner is the healthy way to start.
Yeah, Planned Parenthood is really, really great. We should be supporting them a lot. They have a lot of free resources. They like help you with so many things, not just sexual health, but
I mean, outside of Planned Parenthood, I'm not really sure of any other organizations, especially for the age range from like 18 to 26, or like 26, like, that sweet spot when you're off your parents', health coverage. So I think we definitely need to work on that as far as Sacramento community.
There are all kinds of myths about STIs, that they are something bad or that they make you dirty in some way, but they're just a part of life that happens.
One of my friends in high school was born with HIV. They're HIV positive because of their parents, and a myth was that they could transport it to other people through touching them, or that they deserved it, and those are both not true, because obviously someone's disease status is not their fault at all, especially when they're born with something.
I've heard some myths like you can catch AIDS from like kissing, which is not true.
That you can get STDs from just like rubbing up against each other, like on the dance floor, which is also not true.
I think it's important to debunk myths of how to protect yourself. Is not just wearing a condom or wearing contraceptive. It's getting checked every now and then.
Well, there's like a lot of misconceptions about like pulling out, all of that. That doesn't cause pregnancy. It does. There is risk a lot. So I feel like a lot of people tend to do that. And also birth control. There's just so many misconceptions about like you gain weight, all of this. So I think it's just better to talk to a doctor and get opinions by them instead.
So as we were out there, there's conversations of lack of resources. They're not sure where to go. They're not sure what information is out there. There's this stigma, as we heard, of certain STIs and there's so much conversation going on out there. So I want to focus a little bit about STDs specifically and testing. What symptoms, or how can we start that conversation within the community?
It's a great question. And as they were mentioning, some of the concerns are access. Like, where can I go to get safe testing that's not going to break the bank? Where should I go without being judged or labeled? There are certainly stigmas around sexual behaviors, and if you are diagnosed with an STD, of course, a lot of people do have shame, right? The reason I think this is important to talk about, again, is if we back up, is that people think I don't have a lot of partners. I've only had a select number of partners in my whole life. Well, I've unfortunately had cases where I have patients that end up HIV positive with one partner, and they've never had a second partner. It's also asymptomatic. So getting testing to make sure that you know what your diagnosis is, to make sure that you can be treated. Many of the STIs that we actually treat, if untreated, can affect fertility, be able to safely give birth, and downstream can cause numerous issues. A classic known example is syphilis. Syphilis is a asymptomatic disease. You don't have symptoms. You have a sore for a very short period of time that will disappear. And if left untreated over years, that can affect your heart valves, and it can even actually go into the brain and lead to something that seems to mimic dementia. Now, it's all treatable, but patients are not aware, and they're not aware of the tests that can be done and very easily, relatively cheaply.
Yeah. And I like how you just mentioned, you shared a little bit about, that's neurosyphilis, right?
Correct.
I'm aware of. And you shared about the importance of testing. We asked community folks as well, how regularly do you get tested, or how regularly do you recommend to get tested? Many had different answers, but what do you suggest? What's the best way to get tested and regularly?
That's a great question, and there's no one answer fits all. The CDC does have some guidelines basically saying all persons should be tested for HIV at least once in their life. I will say that I have a large geriatric population at the moment, and some of them have never been tested. So again, it's not always necessarily the standard discussion that they have with their primary care doctor. So I recommend during every physical exam, at least once a year, having that social history conversation with their provider. You can be talking about safe substance use, unsafe substance use, sexual health, last time you were tested, and whether or not you need testing. Because the first question is, do you need testing? The answer is almost always yes. The second part of that question is, what testing do you need, and which areas need to be tested?
Oh, yeah. As you mentioned, what areas and what tests do you need? Many community members also were kind of like, I just don't know how to start that conversation with my physician. They're ashamed, they just go in, do their physical and so forth. What's the best way for our viewers to start that conversation, either with their parents, with their youth, with their physician? what's the best way to start that conversation?
It's a great question. When I teach medical students or residents, one of the conversations I always have with them is it's our responsibility to make the patient feel safe, feel heard, and let them have that conversation. Everybody's practices are a little bit different, and we're in a world that we have multiple different cultures. And in many cultures, you're not supposed to talk about sex. It's a very taboo subject for many people. And so actually creating that safe space and explaining why we're having the conversation is very important. So again, creating a safe, non-judgmental environment. One of the ways that I can do that is I have posters in the room saying everyone should be tested and here's why. And so while they're waiting for their physician to come in, they can actually be reading about that and have those questions triggered, and those are available in multiple different languages. The physicians also, though, have to educate themselves and be aware that there are different needs in different populations. The utilization of the resources that are available is important to know, because where you work, you might only have certain resources available, and so you have to offer what's available. If you were my patient and you were coming in, I'm going to ask you a series of questions. I ask all of my patients, please tell me, do you smoke? Are you using any street drugs? Do you drink? And then we get to the sexual history. It is an uncomfortable conversation for many people, so I try to keep it very bland, non-judgmental. How many partners have you had? What type of partners do you have? What body parts go where? What kind of exposures do you have? And when were you last tested? And I'll say, well, the reason that I'm asking is there's something called 3-point testing, which is the standard for anyone that has high-risk exposure. And we can define that, and that's defined differently as well. But if you have oral sex, you can get oral gonorrhea and chlamydia quite easily. It does not have to be penetrative sex. And it's asymptomatic most of the time. And so if you don't have a throat swab being done when you have STD screening, you are actually missing that area completely. The same thing as anyone that actually has sex with rectal sex, anal sex, or using the back hole, depending on how they want to terminate or use terminology differently so it's not triggering for them. That is a separate swab, because again, that's not going to show up in your urine or your bloodstream. So 3-point testing, you test the areas that are active. And the way that a physician can help make it less judgmental is I order 3-point testing for everyone. And I'll say, if you have active sex orally, test that area. If you have any anal sex, test that area. If you don't need it, you don't have to do that test, but it's ordered for you so you can test the areas where you were exposed. And again, most of the time that's asymptomatic. How often should you be tested? That question follows up with how many partners you have, or if you have a known exposure. So in general, at least once a year. If you have more than 3 partners in a year, you should be tested every 3 to 4 months. And that can actually change depending on your risk factors and who your partners are.
Wow, that right there is an important thing to have. So please, viewers, get regularly tested, speak to your doctor. And I love that you mentioned dismantling these barriers within the clinic area. Having language, access to language information in their language, asking the right questions, even the medical terminology for our LGBTQ+ community. Those are really important. Another thing that we asked when we were out in community was myths. So one of the myths that we heard is, oh, well, I heard that you can get an STI from sitting on a public toilet. And we were like, nope, debunked. And there's other myths out there. What misconceptions have you come across in your practice?
There's a lot. That could be a whole separate conversation. Yeah. I've had people say, well, if I don't have penetrative sex, I'll never get an STI. And STD, sexually transmitted disease, versus STI, sexually transmitted infection, is just a language evolution in the medical community. If you have any kind of direct skin-to-skin contact, you could have a transmission of some STIs. The examples, I believe that one of the community members mentioned was HSV, herpes simplex virus. You can get cold sore virus, which is typically HSV1. You can get genital herpes, which is HSV2. However, if someone that has a cold sore was to perform oral sex on someone, they could potentially transmit that to a genital area, even though that's HSV1. Again, that's a skin-to-skin contact. Sometimes it's body fluid, and sometimes it would be penetrative sex. Again, it depends on the exposure and it depends on the disease type. And so I tell people, I said, if you want to practice safe sex, there's many ways to do it, but if you're having sex, you're having exposures.
Yeah. There was another one that we heard that this one specifically, quote, lesbians don't get STIs because we're same sex. What are your thoughts on that?
That's something I've heard before.
Yeah.
It is something that unfortunately is very untrue. The women that have sex with women is a broad community, so I won't limit that to just being lesbian. They do have exposures. They are having oral sex. They are having penetrative sex, whether it be with different things, toys, you name it, and that can actually transmit body fluids back and forth. There are exposures. And unfortunately, that is one community that is under-tested quite significantly because, again, there is the belief that they don't have the same level of exposure. And that is a separate conversation I do have with people. Depending on what you do, your risk factors can be much higher. An example in a community, oral sex versus penetrative sex. Again, there is much higher risk for penetrative sex compared to oral sex. And then vaginal versus anal sex also carries different risk factors. And that, again, is based on the exposure and the type of activity.
You mentioned on risk factors, and to minimize risk, we all know, we're all aware of condoms. Condoms is a big one. That's been promoted long, long ago. And something new has come out to surface, and I love it because as I've been studying it, it's called DoxyPEP. Can you share a little bit more about this new study and new initiative that's going on in the community?
It's a great question. The first thing I would say, however, is condoms do work.
Yes.
All right, they are not foolproof. They are not going to always prevent a pregnancy. They are not always going to present protection against an STI, but they dramatically reduce the risk factor of transmission. So if you have no other options other than condoms, definitely I would strongly recommend them because they do protect people. If you're not using condoms, or even if you are and you want to increase the level of protection that you have, there's two different options. There's HIV prophylaxis, known as PrEP. Commonly, Truvada is one of the more common ones that is known, and it's generic and very cheap and very readily available for people. And then the newest discussion factors are around DoxyPEP. So doxycycline is an old antibiotic that's used for post-exposure prophylaxis. So typically speaking, if you take 2 tablets of doxycycline within 24 to 48 hours of having an exposure, you can reduce your risk of transmission of certain STDs by up to 80 or 90%.
Wow. Okay, and that one specifically for STDs, right?
Correct.
Okay, now you mentioned about pre-exposure prophylaxis, which is for HIV. How does that one work?
HIV prophylaxis is a once-a-day tablet. If you actually do take it, there's a 99.9% reduction in the ability to become HIV positive, and it's just a once-a-day pill. There's newer modulations, which are injections, which can be at different time variables. They're, of course, much more expensive because they're newer, but all of these have actually dramatically reduced the number of HIV transmissions around the world.
Thank you for watching County Edition. We'll be right back.
Love is a lesson that doesn't end. It knows no conditions, so you better buckle in. Love keeps you on your toes. It never stops, only grows. Love isn't easy. It's a commitment, especially when they're being their most resistant. Love is being prepared for the journey ahead. Love doesn't let any concerns go unsaid. Love is finding the right seat so you can take a breath. But remember, love isn't lax. It always double checks. Check that your kids are in the right seat at nhtsa.gov/the right seat. Love protects.
That's incredible. DoxyPEP, PrEP, and then I know there's another one, PEP, right?
Great question, and actually extremely important one.
Yeah.
So PEP stands for post-exposure prophylaxis.
Okay.
So this is extremely important for anyone that actually has a known exposure or they had a sexual encounter where they don't know the status of their partner. So if you can get the treatment for post-exposure prophylaxis within 24 to 48 hours, up to 72, but as soon as possible after an exposure, and you're able to take that medication for a 30-day period, you will not convert to HIV positive status. And so this is a different formulation. So I always tell my patients, do not email, do not staff message, call them and actually make sure you get the medication as soon as possible because you want to have that post-exposure prophylaxis to prevent any possible conversion to HIV positive status.
There's so much medical advancements out there, and this is incredible. You know, there's so many organizations here in Sacramento doing incredible things. we had the privilege and the opportunity, the crew and I had to go to Arden, where Sunburst is. Are you familiar with that organization?
I am.
Okay. Well, let's go ahead and take a look at what Sunburst has to offer.
Well, good afternoon. I'm Jake Bradley Rowe, the Executive Director of Sunburst Projects, a Sacramento local community-based organization providing services to the HIV community, focusing on prevention and education around your HIV status. Sunburst is always trying to really get into the community and educate about the importance of knowing your HIV status, and that we have free services here for you that you can come use every day, Monday through Friday, from 8 a.m. to 6 p.m., walk-in, no appointment needed. So we really focus on that, offering those services in English and Spanish, and making sure that every community member knows that we have a place here for you that's safe, stigma-free, and available. Sunburst established our prevention program in 2022, and since then we've become one of the larger testers in Sacramento County. We have worked really hard to get a hold of the folks that need the services that are high priority audience for public health department, and really offering a place that they feel comfortable, that they can come in our doors knowing that there's no shame or stigma around getting an HIV test, and that everyone is welcome. So I think the fact that our numbers prove that we're reaching those audiences shows that we're really actually doing the work and we're getting a hold of the folks that we should be testing. Sunburst Projects really could use the support of our community, but I think the most important way that you can support us is coming here and utilizing our services, getting that free HIV test, getting access to harm reduction products like condoms and lubrication, and most importantly, knowing your status, because the more folks we can turn into our funders saying that we've served and help them to be aware of their status, the more opportunities we have to get additional funding to grow our programs. So come to Sunburst Projects and get an HIV test.
Sunburst had amazing things going on with them. Now, Sunburst is one of the many organizations here in Sacramento.
There's a lot of activity in the community to try to educate and protect our community members. This type of forum is amazing because it actually gets that information out to them. For example, the LGBT Center opened the Marsha P. Johnson in South Sac for a patient population that is very diverse, underserved, so they actually have additional access, but don't have to necessarily come downtown. Sunburst has multiple different sites where they're also located in different areas where they're able to bring that material to people that actually need it.
And it's a quick and easy thing. They go in, get tested, and they have the results right then and there for the HIV testing. And we'll go ahead and put those on the screen. All of these amazing organizations have walk-in HIV testing, STD testing, PrEP, also an opportunity to have access to PEP. There's a pharmacy as well, Pucci's Pharmacy, who does amazing work out here in Sacramento. We've talked about the topic, all about the medication and so forth, but the stigma is still well and alive for individuals living with HIV. And there's this amazing campaign, You Equals You. Can you talk a little bit about that kind of work and what it means?
That's a great point, and that's something that I've actually had multiple discussions on. Many times I'll have a couple that will come in and one patient might be HIV positive and the other person is not, and they want to protect themselves, but they're in love and they want to say, how do we do this? Can we do it safely? The answer is absolutely yes, you can. You equals you is undetectable means you're untransmittable. So if you're an HIV positive individual and you're on your antiretroviral medications and you are undetectable, you cannot transmit that virus. You are considered to be essentially negative from an infectivity standpoint. And so that really does provide a lot of reassurance for these couples. And if you want to even stack the deck a little bit more, the partner that is negative would potentially get on Truvada or a different version of PrEP, and there's essentially no way that they would become positive.
Yeah. And would the person who is negative also have to take PrEP while the person who's positive take their HIV medication?
Now, you can get different answers from different people when you ask that question. The academic answer is if they had recent tests and their viral load is undetectable and they've been stable and well controlled, they cannot transmit. Their partner technically does not need to be on PrEP. Again, some of the more conservative people will say, well, that was based on your last lab test. Are you taking your medications on a regular basis? Are you well controlled, et cetera? And so some people, again, are overly cautious, in my opinion, but then they'll have the partner take PrEP just in case. Again, it is a very well tolerated medication. It is a generic medication. It is super cheap, and it just essentially eliminates that worry for many of those couples.
Wow. Doctor, we can keep going and talk about so much on prevention, education, and all the other STDs out there. Now, vaccines are a big topic right now in the community, and I want to touch a little bit about the HPV vaccine. Could you share a little bit of information on that?
Absolutely. So that kind of ties in, we're talking about prevention, we're talking about access, we're talking about stigma, because there's a lot of misconceptions about vaccines, which we won't go down that rabbit hole. But there are also a lot of different tools that we've made available for our members. Like, again, I'm a little biased because I work at Kaiser Permanente, but one of the tools that we actually created was something which was called an e-visit. So the patients can just go on their phone, open an e-visit and say, I'm interested in getting STD screening, and they can order it themselves and then walk into the lab without having to have that kind of uncomfortable discussion or talk to a provider that might not be knowledgeable about 3-point testing. They can also send a message that would automatically go to someone that's knowledgeable about PrEP for HIV pre-exposure prophylaxis. Again, we don't want any kind of delays for any kind of known exposures. You should be calling and talking to your doctor if you have any kind of symptoms and things. The vaccines are usually specific conversations with your care provider, because it's going to depend on your age, your risk factors, what you're doing, and whether or not you should be having those. Now, HPV vaccine has been around for quite some time, and every study that's been done in it that I have read personally actually shows that there's been a dramatic reduction in cervical cancer in women. And that is actually the primary reason behind that. Now, cervical cancer is triggered by HPV virus, human papilloma virus. Now, there are 9 versions that can cause cancer. The newer versions of the HPV vaccine actually protect you against the majority of those. And so it's a series of 3 vaccines, and oral and throat cancer from HPV is overtaking cigarettes and alcohol as the leading cause of oral cancer. The HPV vaccine will prevent that. So again, if you're having any kind of oral sex, you probably should have an HPV vaccine. And if you're having any kind of anal sex, and anyone that actually does have anal sex, they actually have an increased risk of anal cancer from HPV. If you're vaccinated against the HPV virus, you're dramatically reducing that risk factor. It also dramatically reduces the risk of any kind of genital warts.
Oh, yes. Genital warts are something that is treatable?
Treatable, but it's a lot like cold sores and herpes. It is something that's typically with you for life. So they can be treated. People just want to avoid them. They can be like frozen off with liquid nitrogen, which is a slightly painful process. But again, even if you have that, there is some data that's emerging that if you haven't been previously vaccinated with HPV and you get vaccinated, it can help suppress any future outbreaks.
Is that like the herpes, where if you have an outbreak and say you have genital warts or wart, by skin-to-skin contact, is that the way of transmission?
Correct.
Okay.
So anyone that actually has genital herpes or cold sore, and if you have an open sore, you are considered contagious. You are shedding virus. You're actually considered very contagious. There is a theoretical risk, even when you don't have an open sore, that you could transmit. Now, there are medications that these people can take that keep that virus suppressed. So antiviral medications against HSV, people use them a lot for cold sores. Classic example would be Valtrex. And that actually just prevents the virus from replicating. If it's not replicating, you can't really transmit it. And so again, there's treatment options. To go back to your question about vaccinations, HPV is one of the most well-known, but depending on where you're at in the LGBT spectrum or what other persons that may have sex with the same genders or non-binary or anywhere along the transgender spectrum, there's also hepatitis vaccinations that should be considered. Hepatitis A, hepatitis B, you can actually get that in one vaccine. It's called Twinrix. You can actually get meningitis protection. One last vaccine that I wanted to make sure that people are thinking about is the Mpox vaccine.
And that's just 2 like little vaccines here at on the forearm. Yeah.
Very
easy.
protective vaccine, and I recommend it for anyone that's at risk.
Yeah.
We'll be right back after this break.
we talked about all of these amazing access, and I want to go circle back to LGBTQ health. And specifically, I know we're talking about LGBTQ, and specifically PrEP was promoted to the LGBT, especially men who have sex with other men. But HIV doesn't discriminate, and STIs don't discriminate either. Anyone can get this, can get an STI or HIV. But what about the process of getting PrEP, and who qualifies to get PrEP? Who's eligible to get PrEP?
Very good questions. And anyone that's having sex is at risk for exposure. And so again, depending on their sexual activity, at the type of sex they're having and their exposures, they should be getting tested, and they should be having conversations about getting on HIV prophylaxis. So HIV prophylaxis is not just for gay men. It is not just for transgender individuals. I have many straight men and women that typically have sex with, opposite sex. They actually have higher risk factors because they might have higher numbers of partners. So if it's appropriate, we should be having conversations with them about having medications to protect themselves. And again, anyone can actually get these medications. Again, it's a conversation that you need to be having with your primary care doctor. Again, depending on where you're going, there is a prescription that's required by it. Some pharmacists will actually allow prescribing. The LGBT Center, for example, in Sacramento can do starter packs to get patients on board to protect them until they're able to follow up with their primary care doctors. Of course, you do need to be tested ahead of time. We have to make sure that you are negative before we start giving you some of these medications. There are multiple options available for protection.
Yeah, and then there's a new bill where a pharmacist can give you a 30-day prescription until you get into a medical provider.
Correct. And I think that's a crucial point. Historically, depending on where you practice, and PCP could see you. They evaluate you. They're not as knowledgeable as we wish they would be. And they then refer you to an infectious disease doctor to be having that conversation. And they might refer you to a nurse or a pharmacist to have that conversation. And in that 30-day period, while you've been waiting to be seen, you can be converting and becoming HIV positive. That's not acceptable. There should be 0 new cases of transmission. You should be able to get the medication, do the labs, have that follow-up, and if the meds need to be adjusted at a later point, I believe we actually are doing our patients a disservice by waiting. We should actually start them and then have that conversation later if we need to do adjustments.
Yeah. Getting tested is always scary. It's fear, Either you're fearful of blood or needles or just the results. It's scary. What advice would you give our viewers on how to overcome this fear of, hey, let's get you tested?
Very valid question. I trained out in New York, and in New York there's a law that says if you come through the emergency room, you're going to be offered HIV testing. And I absolutely love that because, again, a lot of people, it's the first and only time they'll ever be offered that. So again, here in California, we don't do that typically unless it's an actual known exposure and the patients are requesting it. So again, having the conversation to request the test is important, but it's intimidating and it's scary. I will say, I am intimidated. I get a little nauseous if I'm waiting for my lab results. I can be very anxious as well. It's a human response. What I do tell people, however, is if we do have a positive diagnosis, which is the worst case scenario, we now have medications that we can get you on, we can suppress your virus, and you can have a normal, happy, healthy life.
Wow. And if our viewers, if you're afraid of needles or blood, the organizations on screen, they all have walk-in or by appointment of an HIV test, a little prick of the finger, just a little drop of blood, and then your results are ready within 20 minutes. So even the time, I know before testing, you had to wait a week or something. It was long. But now you have rapid results. Even at-home HIV testing kits. The Take Me Home program, which is an HIV test that you do in your mouth, right?
It's an oral swab, and they send it to your house, and someone would follow up with you with the results.
Thank you, Dr. Jason Gritti, for spending time with us. We talked about prevention, talked about vaccines, testing, and the great resources out there. And that's all for today's episode of County Edition. Thank you for joining us as we discussed this critical role of taking control of your sexual health. Remember, education and testing is key to staying healthy and knowing your status. Stay healthy, Sacramento.